All right, let's talk about keratoconus. It's a serious eye disease, and until recently, it could only be treated with a corneal transplant from cadaver tissue. Now, ophthalmologists and corneal, you guys, I practiced. I practiced the word so hard. What is it? Keratoconus.
That's
so
right.
much that now I can't say corneal. Okay, he's a corneal specialist. Dr. Fessel Hawk of the Key-Whitman Eye Center is here with news for patients with keratoconus. Good morning, Dr. Hawk.
Good morning. Thank you for having me.
I have one of the words down. It's going to be okay. Tell me exactly what keratoconus is.
So, Erin, keratoconus is a disease of the cornea, which is the front part of the eye. People who have keratoconus, their cornea starts to become a little irregular, starts to kind of bulge out like a cone, and that leads to blurry and distorted vision.
So do we know what causes this?
You know, the causes are somewhat unknown. We know that it tends to run in families, so there's probably a genetic factor at play. People who do a lot of aggressive eye rubbing can get progression of keratoconus. So we don't really know the cause, but we do know it's due to probably some abnormality in the collagen of the cornea, which causes it to become weak.
Got it, got it. Okay, so is there a new treatment for keratoconus that can be used?
Absolutely. So we're very excited to offer collagen cross-linking at Key-Whitman. You know, in the past, the only treatments available were hard contact lenses, and then if the disease kept progressing, people needed a full-thickness corneal transplant, which is a pretty big deal. So now we have this procedure where we basically put some medicine on the eye, expose the eye to some UV light, and that strengthens the collagen in the cornea and prevents that bulge from occurring. In most cases, we can prevent a corneal transplant.
Nice. Okay, perfect, because it sounded like what you said, the transplant is quite aggressive, and then this is kind of a middle factor to kind of help out.
This is quick, easy, fast recovery.
There you go.
In most cases, people don't need a corneal transplant.
So what's the first step if someone has keratoconus, they're thinking, I need to get this done? What's the first step for those patients?
So absolutely. The first step would be to come in to see us. You know, we have offices throughout the Metroplex, so they need to call us and get in to see one of our doctors. We would do some testing to confirm that they have keratoconus and also that they be a candidate for the cross-linking, and then we go ahead and get it set up.
So are there any symptoms that maybe really poke out that maybe when people are like, oh my gosh, I might actually have this? Is there something that stands out most? You
know, the most common thing would be if a patient's kind of gone from doctor to doctor, tried different glasses and just can't see as well as they need to. And, you know, those types of patients probably need to come see us so we can test for keratoconus.
Yeah, well, I think that plays into that annual checkup, right? Always getting your eyes checked so you know if something's coming.
So we'd be looking for things like that, yeah.
All right. Well, thank you so much, Dr. Hawk. Appreciate you being here. For more information, call 972-769-2020. You can also go to keywhitman.com.